Sure, you can always shop around for flooring, but in the end, it all leads back to the one place you probably should have started, the experts at Carpet One. Save yourself the time and the hassle and let Carpet One help you find the right product at the right price. Beautifully installed, guaranteed. Come see the One, Carpet One, on the Business Loop in Columbia.
Good morning and welcome to Radio Friends on Friday, August the 26th. I've got an old friend, whether we go back, I guess 15, 16 years, Dr. HANA Solomon. Good to have you here.
So nice to see you.
And you are quite an entrepreneur. Isn't that a good way to describe you?
I
think
guess.
you are. I think you are. You are the inventor of a wonderful product we have here.
Thank you.
It's called Nasopure. But this is something that goes back many, many, many years that people have used for ages, right?
Right. A technique of nasal irrigation. It was used to be used with a neti pot, which is like an ancient, it looked like a teapot. And the Buddhist monks used to wash their nose with this teapot. And I actually tried it in my clinic for my 2-year-old patients starting 30 years ago. But most people didn't want to put a teapot in their nose, including me.
Right.
But the idea of washing made sense, right?
So you would tell your patients, you were a pediatric doctor, and you would tell your patients to wash their nose.
And they say, what? You want me to do what?
So why would you tell people to wash their nose?
Well, it was the number one reason that brought patients in to see me other than well childs. Nose issues, sinus issues, ear issues, throat issues, coughing, and asthma all start in the nose. And so because I'm really an old hippie who then went to med school, I was very focused on the natural approach. And I was not interested in giving antibiotics. And I learned about how...
Well, we give too many antibiotics to start with.
Very scary. There's there's many studies that support this. So washing the nose made as much sense as brushing the teeth.
Or washing your hands.
Wouldn't you agree?
Yes, yes.
And the nose filters 10,000 liters of air every day. And
we breathe 10,000
10,000 liters. And we make a pint to a quart of mucus per day in the nose. And all those things are good and it helps us. But I believe a nose deserves a washing just like your teeth deserves a brushing.
Okay, or think of it as your air filter in the furnace or air conditioning. Okay, you look at that air filter, you got to change it on a regular basis because if you don't, it gets totally clogged. With all kinds of debris and gunk, and it doesn't work right.
And what happens to humans when the nose gets clunked, or gunked, as you say? You get sinus infections, you get ear problems, but maybe worse is then you're forced to breathe through your mouth.
And then you're not filtering, are you?
And then you're not filtering. Oh, you remember filtering and warming and humidifying the air. So then our bronchial tubes take the brunt of it, and what do we do to protect the lungs? Then we start coughing. We now know that if you wash your nose, if you have asthma, your symptoms are reduced, the medications you need are reduced, and the visits to the doctor is reduced.
Okay, so when you breathe through your nose, you're humidifying the air that comes in.
Yes.
So how did you come up with the idea of
this instead of a teapot?
Yeah.
Okay, a teapot.
Now, people listening on the radio, this is a...
It's an angled, it's a slightly positive pressure plastic bottle with a funny neck. And that angle on the neck allows you to wash your nose with the direction of the air you breathe. So basically, I learned this by accident. I personally cannot do the neti. And I had a rule, don't ask a 2-year-old patient to do something if I myself couldn't do it. So the neti made me feel like I was drowning and choking. When I took a generic bottle and tested it, I found it very easy to wash when you wash straight back instead of going up. The difference is straight back actually vacuums the sinuses, and going up in my opinion, floods the sinuses.
So you came up with a design for
Yes.
this bottle.
Yes.
Okay, and then the concoction that you put in the bottle.
Yes. Was taught to me by Dr. David Parsons, I think the world's most wonderful pediatric ears, nose, and throat doctor. And it was his recipe, and I continue to use exactly this. And there is no other one like this on the market. It is not patentable because it's been used for 40 years in the operating room, and all of our studies are based on solutions similar to this. And the difference, what this offers, studies show that if you use a 2-to-1 recipe ratio like that, you remove 80% of the allergens as compared to just a little bit of ocean water.
This is salty, right? This is salty.
Very salty, but very buffered. What does that mean? The super salt means it shrinks things, but it doesn't burn. So when you could compare, let's say, ocean spray with a hypertonic buffered, the studies show it does this. It removes 80% of the allergens, which is enormous. You're just washing out 80%. It improves the mucociliary transit time, which means the little hairs work better. It thins the thick, sticky secretions, and it shrinks the swollen membranes. And it kills germs.
Yeah.
And it doesn't hurt.
Right. Now it took Hannah a long time to convince me to try this, but I did.
It is not a typical American daily habit, but it is my mission to try to get folks to incorporate washing just like they brush their teeth or wash their armpits. I think it's an important part of hygiene.
Yeah, and you're not too young to. Is there an age limit?
You have to be old enough to stand and hold a toothbrush.
Okay.
And so a 2-year-old.
Yeah, a 2-year-old can do it.
Yes.
Okay, and it really it takes just a little bit of getting used to and convincing yourself that it really is okay to do.
There's a misconception with adults that it's going to feel like the feeling you experienced when your best friend pushed you in the swimming pool as a teenager.
Yeah, no, it's not that.
And that is not it. And
So if people want more information, they can simply go to the website. It's www.nasalpure.com.
Correct. NASOPURE.
Okay, and all of the information will be on there. There even are there videos on there too?
There's videos, there's articles. If somebody wanted a copy of my book, they could email us, and I'm happy to just email a
Cleaning
PDF.
the Air, isn't it?
Clearing the Air one nose at a time.
Clearing the Air one nose at a time.
Yes.
That's your book that you wrote.
Yes.
So when did you have time to write the book and run this company and invent it also?
I do a lot of lectures to medical audiences, and basically this is a composite.
Right.
Can we mention that these are assembled by adults with disabilities?
They're all put together, and it's all packaged by Adults with Disability here in Columbia.
That's right.
Thank you, Dr. Hannah Solomon.
Happy breathing.
Okay, bye-bye.